A couple other questions on microneedling.
Sure.
We'd love to pick your brain on because it's one of the hot topics that a lot of people, both in our office and a lot of people in the fashion community, have been kind of celebrating it recently. Our understanding of it is there, and you can explain this better, but it's basically creating a slight topical damage to the skin so that it can absorb product better. Um, is that is that correct as a common understanding? And is that something you do in the office? And what kind of results do you tend to see from it?
Sure. So what you were describing is a common modality for microneedling to allow penetration into the skin of a topical product. I do advise people to make sure they're using a product, if they're using it in combination with microneedling, that is intended to go into the skin. Because there are skincare products that we all use that have preservatives and others in it, which we want. The reason we want those in those skincare products is that they don't develop mold and bacteria. But we don't necessarily want those ingredients going into the skin. So you have to think through, make sure it's a product that's designed for that, speak with a dermatologist. The products that we use in our office are designed to be able to go into the skin.
That's
And
fascinating.
a common one that we'll sometimes consider using in this setting is our own blood, like the platelet-rich plasma and those others, to try to elevate those levels of anti-inflammatory molecules and growth factors.
So that's the vampire facial?
Well, some people call it that, yes. That bloody photo of Kim Kardashian that really created that term, I think.
Okay.
But I think that it's interesting you said it that way, though, because I do think that the majority of people, at least of my patients who discuss microneedling, think the primary purpose is to create these focal points of inflammation to drive a collagen response or collagen production.
Yeah.
I'm a little hesitant to endorse it for that. I don't find that it's particularly effective there. The concept makes sense because we're trying to create a micro injury and that does stimulate a healing phase, much like we're able to accomplish with fractional resurfacing procedures. But I haven't been wowed by the impact of those yet. I think that the reason sometimes facialists can have success with that, and I have a lot of respect for many facialists out there, they're able to often give a surface swelling, which can make some of the texture of the surface skin look better, pores, fine lines, but it might not be very long lasting. So we want to look for ways that can make a long-lasting stimulation of the collagen. So there are concepts that we're using in cosmetic dermatology that use needling a little more effectively. And one of those primary methods is using what we call fractional radiofrequency. Essentially, we're taking needles, stamping them into the skin, and at the very tip of the needle is a radiofrequency current, which is essentially heat deep to the surface skin. And that fractional heat, that needling of the skin, can create what we would call fractional heat that builds collagen from below. And that tends to have a greater impact. That is a little more uncomfortable, so you would want to use topical numbing cream for something like that. We even sometimes use a little bit of nitrous gas, like laughing gas, to just ease the anxiety level.
Okay.
And that really does the trick. And people tend to look pink and treated for the week or so following, and it does a good job of combining needling and heat to get a greater impact.
Interesting. And what is that called, that procedure?
There's many types of those. There is an Infini device, a Genius device, a Profound device. So they're out there. It's more just having a cosmetic dermatologist discuss with you that option of needling with radio frequency. But I think most commonly people refer to it as the Infini, like infinity, but just
Okay. Okay.
I'll just mention, just if it's of interest to you, there's even a newer concept in needling of the skin that is not FDA approved yet, but in research studies, and it may be something we'll see in the next year or two. Instead of just putting a needle in and out of the skin, there's a concept of what we call dermal microcoring. What that means is the needle is a little wider than just a needle, and it actually takes out a fragment of the skin. So it goes in the skin and takes out a very tiny fragment. Okay. The idea is that we might actually be able to remove, let's say, 5 or 10 or 15% of the skin surface with these very fine needles.
Huh.
That might actually shrink the skin and tighten the skin.
That's fascinating.
It's amazing. So we're working on clinical trials. We're seeing where it will take us, but this entire field is growing rapidly, and we love doing the studies.
That is amazing. And that seems like it's longer lasting than the typical traditional combination of Botox filler everything else to kind of get your.
If we can prove good safety and efficacy, we're hopeful that it becomes FDA approved and we can use it. Let's
Amazing. Amazing. You heard it here first. That's fascinating. So then I can wager a guess that you wouldn't recommend the at-home microneedling treatments.
If they're available and you can use them gently and safely, don't do them too aggressively. Don't think if you do it harder, it will work better. You might
Right.
cause problems and scarring and
Yeah.
infection. So be gentle. And if you're using it to try to enhance delivery of a topical product into the skin that's designed for that, yeah, I'd be okay with that. It might actually help.
Okay, great. Amazing. Nothing can replace an office visit, but that's good to know.
True, but I do endorse the idea of taking care of our skin, looking our best, and the better our home strategies are, the better the in-office procedures will be.
Yeah, yeah, makes perfect sense.
Yeah.
Amazing. Well, thank you so much, Dr. Anolik.
Thank
We
you.
appreciate it so much. We'll put all your contact details up so everybody can be in touch if they want to come visit you at the office, because there
Great.
is no better service provider. So so much for your time.
You're fine.
Stay safe.
You too.
Hopefully see you in real life soon.
Soon. Take
Okay.
care.
Take care. Bye.